Good morning, everyone. Thank you for joining us here on the Cmrl Local 4 News. The City of Amarillo is preparing to have a briefing about the coronavirus pandemic. We're taking you live now for this breaking news.
Health Sciences Center. Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Michael Emmentier, Chief Medical Officer for BSA. Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. At this time, we'll go ahead and turn it over to individual panel members, and then we'll take direct questions from our media. Let's go ahead and go to Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, thank you, Dave. And good morning, Amarillo. Thanks for joining us this week to get an update on where our city stands with COVID. I think the question I'm getting most often is school starting? How should school start? Are people going to wear masks at school? So those are questions that the school districts are all working on. We have 5 different school districts here in the city of Amarillo. Refer you to your that information, and I know at that load because normally in August they are dumping information on us, and it's not going to feel like that this year. So in our deep desire to know all of the things we normally want to know when school's starting, I think instead as a parent we're going to have to shift our expectations. Instead of knowing this is going to be an opportunity for growing, we're going to get a chance to grow in patience, to grow in grace, to grow in flexibility and adaptability. And I just would ask on behalf of those school districts, they've worked so hard since COVID started. All summer they've been working. They're still working, and they're giving you all of the information that they have. And we're recognizing that they're leading in an environment where things are constantly changing, and new information is coming to them every day. So we just have to be on that journey with them. And I know your heart is the same as mine, and that's to pull in the same direction as that school leadership. So let's go all in on helping our schools get started by being patient, by showing grace, by being willing to change our plans or our expectations, and most importantly, just to follow every COVID measure that you can. Wash your hands often. Wear a mask if you're going to be closer than 6 feet, or just wear a mask. It's a good idea. Definitely be aware of physical distancing. Stay home if you have any symptoms. And I would say, if you're at home and you have the symptoms and you're pretty sure it's COVID, it helps us if you do go ahead and get a test, because then that gives us one more data point to base information and decisions on. So I have heard of some citizens in the city saying, no, I had it, I didn't get tested, why bother when I know that's what I had? You would bother, and it is a bother, I recognize, but it would be for the benefit of the whole city and for your city leaders who are using those points of information to judge and to make decisions every day. So if you do have symptoms, please do get tested, and then go home and rest, take care of yourself. Don't go to work, and please don't send your children to school if you have those symptoms. That's all I have today, Dave.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the Cmrl. Casey, how are you?
I'm good. Thank you, Dave. Good morning, Amarillo. As of yesterday, there were a total of 5,476 cases of COVID-19 in Potter and Randall counties. 3,711 cases in total in Potter County and 1,765 cases in Randall County. We have a total of 4,630 recoveries, and we're thrilled about every recovery. We do have 69 deaths here in our community to report, and we are saddened by each of those deaths. That leaves us with 777 active cases here in our community. Each of the cases represent a unique individual, and I think it's important to note that our staff here at Public Health take out duplicate tests, and we don't report out multiple tests for the same person. And so on the report card that you see, we don't count multiple tests for the same person. The public health drive-through does remain operational. You can call 378-6300, and our call takes takers will screen and direct you to the test site. To date, we've tested just over 6,800 individuals for testing. I do want to recognize the team out at the test site. Those days where it's over 100 degrees, full PPE is very hot to wear all of that PPE. So we certainly want to recognize and thank the staff out at the testing site. As school is on the horizon, like Mayor Nelson said, it's up to all of us in our community to have a successful back to school. Even if you don't have a student who is returning to campus, wearing a mask, washing our hands, staying 6 feet apart, and staying home when we're sick can all have an impact on how we have a safe reopening or a better reopening. Internationally, it was noted that those communities that had lower rates of active transmission did better than those communities that had higher rates of active transmission. And so we have an opportunity to make our own destiny here with those points of prevention. So we do want to thank our school administrators as they have worked very hard. The teachers have worked very hard with their planning efforts and as they put those plans into place as our kids come back to school. I think we're very fortunate to live in a community where there's a large collaborative effort. And so we just want to thank them and thank them on their effort as they return to school.
Thank you, Casey. Now we're going to go to Dr. Scott Milton, Public Health Authority, Texas Tech University. Dr. Milton, how are you this morning? Dr. Milton?
There we go.
There we go. So how are you?
Okay. So good morning. Yes, just briefly, I think that looking at general numbers, it seems like we're holding our own, both in the community and the hospital, maybe even a slight trend downward. I think that's probably because we've got lots of compliance with wearing masks and observing socially distancing and avoiding congregations. And I just want to encourage everyone to continue that, especially as best we can with school starting. And then finally, I'm just anxious to hear what Brian and Mike have to say about their particular hospitals, and certainly to ask them how they feel about the new Russian vaccine, of whether we're all going to get in line real quickly to get that taken. Personally, I would rather not get in line for that. But we can talk more about that later, maybe in the news conference. And that's all I have to say, Dave.
Thank you, Dr. Milton. At this time, we'll go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
I'm doing well, thank you. Hey, good morning from Northwest. So, I think other than the people who enjoy going to the Yellow City Comic-Con, most of us are tired of thinking about masks right now. But that being said, there was a fascinating study that came out this week from Duke University. And the question these investigators were asking was, how well do masks do in preventing the dispersion of respiratory droplets? And so they looked at 14 different kinds of masks. They did a very clever experiment using a laser and a camera to estimate the respiratory droplet load from these different masks. What they found is that N95s, surgical masks, isolation masks, all do a fantastic job of stopping that respiratory droplet dispersion. They also found that polypropylene or cotton masks that have at least 2 layers also do a great job of reducing that dispersion. One very interesting finding was they looked at gaiters. So gaiters are those fleece masks that people wear around their necks and they pull up over their nose and mouth. They actually found that those gaiters are worse than wearing nothing at all in terms of respiratory droplets. What they think is that the holes in that material, in that fleece, are actually causing bigger respiratory droplets to break into smaller ones and really be dispersed out of the mask. So as they say in Florida, it's best not to mess with the gaiters. Okay, so please use those cloth masks, double ply, or the isolation masks. Now, with regard to our numbers, so we are at 28 positives in Northwest. That's been around where we've been for about the last 4 weeks, and maybe even a slight decline, as Dr. Milton alluded to. We have 18 patients in the ICU who are COVID positive. 7 of them are on vents and very sick, and we continue to prone them. It was interesting, when I prepare for this, I oftentimes call a lot of our hospital leaders and say, what observations do they have about COVID-19 patients? And Jerry, our lab director, and Erica, our director of adult critical care, said the same thing to me today. They said, we are seeing all ages affected. So we have actually seen several infants test positive recently. So since we know that children do better with the virus, but they're not immune to it in that sense. And one thing we did have is we had a young lady recently in her early teens come in with the multi-system inflammatory syndrome associated with COVID-19. Now, this is a scary development. It normally happens several weeks after they test positive. And this young lady, it was 2.5 weeks after she tested positive. And these young people develop an inflammatory syndrome, much like what's called Kawasaki disease. So this is an inflammatory syndrome that affects multiple organs, and they get very sick. And thankfully, our pediatric ICU doctor and our pediatric hospitalist were able to aggressively treat this young lady with intravenous immunoglobulin, high-dose aspirin, and steroids. And in about a week, they were able to get this under control, and she has done very well. But my pediatrician colleague, Dr. Matamal, said that on the CDC website, they said originally there were about 300 cases of this described in the United States. It's now up to about 600. So this is a concern in young people who get COVID-19. Thankfully, is a fairly rare development. With regard to remdesivir, the drug we're using, we have treated 83 patients so far. Currently, we have 7 patients on the drug right now. Interestingly, when we first started treating patients, most of those got 10-day courses of the drug. Right now, we're finding that more than half of these patients we can stop at 5 days because they're showing significant clinical improvement. So that's good news. It's extending our allocation of remdesivir, and these people are responding to it very well. We're doing very well on PPE right now. We continue to do elective procedures without a problem, though we are testing everyone for COVID-19 before those procedures. And lastly, at this point, we are down to 8 staff who are quarantined. But we continue to really rely on these nurses that have come from the Regional Advisory Council of the RAC. These nurses are doing a great job working side by side with our incredibly committed staff. So they've been a big help to us. That's all I have for this morning. Thank you.
Thank you, Dr. Weiss. Now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you this morning?
I'm doing well, thank you, and good morning, Amarillo. And thank you, panel, for allowing me to join you this morning. I'll start with some statistics, and then we'll get into some more interesting details. Currently today, we're at 26 patients hospitalized at BSA that are COVID positive. Compared to a week ago, I was reporting that we had 30 patients in-house, and really kind of been holding in that range, 25 to 30 patients hospitalized over the past week. We have a report that we pull that's something that comes out of Johns Hopkins University. It looks at really the counties across the Panhandle. And when you look at the average number of new cases across all of our counties, the 7 and 14-day trends are kind of plateauing in that 80 range. The 3 and 5-day ranges are slightly down. So as Dr. Milton suggested, it may be that we're on a slight downward trend in the more acute phase over the past 3 to 5 days in terms of positive tests, but still holding in a similar range over the past 7 to 14 days. Of our patients that we have in the hospital now, 14 are in the ICU. That's the adult ICU. We have 1 pediatric ICU patient also now admitted. We have 11 patients on our med-surg unit. 10 of the patients that are in the ICU are on the ventilator, analogous to what Dr. Weiss said in terms of the much more critically ill cohort that is requiring mechanical ventilation and that additional ventilatory support. We're still getting a fair number of patients coming through our respiratory triage center, about 20 in the past 24 hours. And fortunately, we have a significantly lower number of staff now that we've had to quarantine, and a lower number of nurses that we've had to quarantine as a portion of that total staff. And we really feel like augmenting our masking policy with KN95s for all forward-facing staff members, that is patient-facing staff members, has helped to protect those that are in non-COVID units more thoroughly. The COVID unit PPE protocol is for N95 masks with full PPE. And again, that hasn't changed now for months. Testing-wise, we've done over 7,100 tests since the outset of the pandemic. We continue with that 18% positivity rate on our total testing. Our preoperative testing continues to go well with our protocol. Over 2,300 preoperative tests have been done, only 20 positives, which is a less than 1% positivity rate with that protocol, and we are not testing everyone. We have an algorithm that really tries to test the higher risk folks and those individuals where the data supports knowing whether or not they're in the incubation period for COVID-19 is going to potentially affect their post-operative course and their morbidity and potentially mortality. Remdesivir is a drug that we continue to purchase via our allocation from the state, and we've treated 52 patients to date with that drug. Similar to what Dr. Weiss mentioned, we're seeing that the hospital course appears to be shortened for those individuals getting the drug. And a key statement there, the drug has to be started early. There has not been benefit shown in the trials with this medication if you start it late. So certain individuals are not qualifying if they come in late, but many that are getting to us early, we're able to utilize that medication, and we're happy about that. We've treated over 200 patients with dexamethasone, which is the other drug that's been shown to have some benefit. And we started utilization of that medication early with our intensivists and hospitalists and medical physicians here. And we've had some good success with that medication. I want to point out two comments on studies, one that Dr. Milton alluded to and one that I want to comment on as well. There was a study that came out in the New England Journal of Medicine last week regarding post-exposure prophylaxis with the drug hydroxychloroquine. And I'm mentioning this because I think this is another piece of evidence that suggests why we should not be using this medication to treat or to prophylax against COVID. There were over 800 patients in this trial. It was well done. It was randomized, placebo-controlled, and there was no benefit if individuals were exposed by the definition that we call exposure, which the CDC uses, at least 10 minutes in close contact with someone within 6 feet, and not wearing a mask or not wearing eye protection as the worst class of exposure. And hydroxychloroquine was no better than taking a placebo. So again, we're trying to make our decisions based on good evidence. And to this date, there has not been good evidence that that medication is effective either for treatment or post-exposure prophylaxis. As far as the vaccine that's being promoted in Russia, I share Dr. Milton's skepticism, and that is there's a reason why we go through trials, phase 1, 2, and 3, and we don't put out vaccinations and other medications without doing a thorough analysis. And it's because there can be potential harm to patients. And again, it's critical that we're doing what the majority of manufacturers are doing in our country, and that is waiting for the phase 3 trial data to come forth so that we can make educated decisions about providing a safe and effective vaccine. And again, we're excited about what's apparently now at the beginning stages of phase 3 trials with a couple different drug companies working in the US and internationally. And I hope that we're going to start having some availability for at least the high-risk folks and healthcare workers by the end of this year, early next year at the earliest, most likely. So again, that's what I would say sums up our BSA current situation. We are fairly stable here now with a high inpatient census, mostly non-COVID, and again, critically watching our ICU capacity so that we maintain enough beds to manage all different types of patients. Thank you.
Thank you, Dr. Lementier. Now we're going to go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Good morning, and thank you for this opportunity. First, to hit our numbers, we have only one COVID positive patient in our hospital on the medical surgical ward. We do have 24 veterans who are COVID positive at home on self-isolation that we also monitor. And then we have one veteran who we're waiting for their test to come back that's a PUI. Couple of announcements I just want to say is on Thursday, August 27th, we do plan to have a telephone town hall talking to our veterans about how we're going to expand our face-to-face appointments and what we're looking at doing and to answer their concerns. I would like to thank our staff and their families for their commitment to responding to this COVID pandemic, along with what they are doing here locally. We've had over 25 of our staff members go to other VA hospitals to assist them in some of these hot spots. And then we have 4 additional going to be going in the next couple weeks. And we know that the strength of our VA is in our employees and our staff. And so just want to say thank you to them. And last, I just want to thank the City of Amarillo and this opportunity to talk to my fellow veterans through this city news brief. Thank you.
Thank you, Dr. Gonzalez. Now I want to go to Jared Miller, City Manager of Amarillo. Jared, how are you?
Doing good. Thanks, Dave. All right, just want to remind everyone, echo what Casey Stoughton said, our drive-through testing center remains open. If you feel sick, you have symptoms you think might be COVID, call the public health hotline at 378-6300 and you'll be screened for our drive-through testing center. We continue to be under the governor's executive orders GA-28 and GA-29. GA-28 was issued June 26th. It provides no occupancy limits, in other words, 100% occupancy in a variety of locations, essential critical infrastructure, religious services, local government operations, child care services, youth camps, and recreational sports programs for youth and adults. It also requires 50% occupancy limits on outdoor areas, events, or establishments for professional sports, collegiate or similar sporting events, amusement parks, swimming pools, water parks, museums and libraries, zoos, aquariums, natural caverns, as well as rodeos and equestrian events. Every business not listed there operates at no more than 50% capacity. In addition to that, there's some additional restrictions. Bars are still closed from noon on June 26th. They can continue to provide takeout or delivery of food and alcoholic beverages if it's authorized by TABC. And with regard to GA-29, issued on July 2nd, GA-29 is a standalone executive order of the governor relating to the use of face coverings during COVID-19. Effective on July 3rd, it states, and still in effect right now, that every person shall wear a face covering over the nose and mouth. And really, I think it's important that we take into account the input from Dr. Weiss and Dr. Lamentier with regard to ongoing research about effectiveness of different types of face coverings. That's this personally for me, because I had been using the neck gaiter. So that's important information to have, that it's not effective in protecting the people around me. In fact, it's actually more conducive to spread rather than not wearing a face covering at all. So that's important information to have. But with regard to the governor's face covering order, executive order GA-29, every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor space wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. The face covering requirement does not apply to the following. I want to go through this one more time. It bears repeating every single time we have these conversations. Any person younger than 10 years of age, any person with a medical or disability that prevents wearing a face covering, any person while the person is consuming food or drink or is seated in a restaurant to eat or drink, any person while the person is exercising outdoors or engaging in physical activity outdoors and maintaining a safe distance from other people not in the same household, any person while the person is driving alone or with passengers who are not part of the same household, any person obtaining a service that requires temporary removal of the face covering for security purposes. Finally, a few other situations where they're not required, but they're highly recommended. And that includes any person who is actively providing or obtaining access to religious worship and requesting and recommending that a face covering is still recommended and still provides safety for the people around you. And any person while the person is giving a speech or broadcast to an audience. Following a verbal or written warning from anybody authorized to do so, a person is subject to is punishable by a fine up to $250 if they refuse to comply with somebody's orders, a peace officer's orders regarding that. To date, we have not had any citations issued. Everyone who has been addressed has complied immediately. That's all I have, Dave.
Thank you, Jared.
Brian Weiss. Hey, real quick, I want to be specific. The gaiters that they looked at were fleece gaiters. So they may be made of other materials, but it was the fleece that specifically was the issue. So I just want to clarify that.
Gotcha. Thank you for that information. Now, Tom, we're going to go to our media members.
All right, we'll continue with the coronavirus coverage on air and online. And to keep up with the latest, you can head on over to our website at myhighplains.com. For now, we'll send it back to program.
First question is, pending test numbers are lower than weeks past. So can that be attributed to faster turnaround times or maybe fewer tests, either one or any kind of attribution to that?
I think a little bit of both. And so we have had some faster turnaround times from the lab, but we've also seen just fewer people come through the drive-through testing site. So in weeks past, we've averaged between maybe 40 and 60 people through the drive-through testing site. And in the last week or two, we've seen around 25 is our average. And so I think a little bit of both has determined the lower pending testing numbers. So absolutely.
Thank you. Also, how involved, as school starts, how involved is the City Health Department in the back to school efforts for local communities?
So we meet with each of the five, well, we meet with all of the 5 school districts, and we've met with them probably every 2 weeks for, oh goodness, since probably July. And then we take calls daily from each of the different districts. And so we try to be accessible for any questions that they might have, so that we can be good partners and that they have access to any questions that they might need answered. And so I think that we have really great relationships. Again, I think I've said it many, many times. This is one of my favorite parts about working and living in Amarillo, is that we can pick up the phone and call one another. We have good working relationships with each other, and so we're able to work together. And I think that's a real benefit for our community.
Yeah, definitely. I wanted to kind of focus more on like the school sports or the fall sports. We know that, college football they've been canceling that. So for school sports, do you see that happening, or maybe kind of changing guidelines for that or anything around that?
I think that would certainly be a question for the districts, and they follow very closely with UIL and TEA guidelines. And so I think those would be great questions that we will have to ask or have to receive guidance from those different agencies.
All right, thank you. Lastly, is there any update on senior living facilities? We know that cases have been up nationally, but do you have an update for here locally?
We've had cases throughout the entire pandemic. I think recently we've had decreases in cases. We haven't had as many spikes, but we certainly are always watching and working with our partners as there are clusters in certain facilities. Our environmental health department and the Texas Department of Health and Human Services works with individual facilities to assist in with any needs that they might have.
All right. Thank you, Casey, and thank you all for your time. I really appreciate it.
Not a problem. Anytime. And I want to go to David Gay of Amarillo Globe News. David, how are you this morning?
I'm good. Good morning, everybody. I guess my question would be for public health officials as well as the hospital officials here. I know that there's been a lot of talk on this conference about the type of mask being worn for back to school, especially. I want to, a lot of the conversations that I've been hearing with my conversations with district officials have been face shields versus face masks. Can we talk a little bit about, are face shields adequate enough for individuals teaching is that an adequate enough face covering, or should they still be wearing a mask during this back to school time?
So face shields and face masks are not equivalent. Face masks provide a filtering type protection. Face shields just don't offer the same protection that a face mask would offer. If there's a barrier with the face shield and you cough or you sneeze, then those droplets would simply go around that barrier, as opposed to being filtered by any type of face mask or face covering. And so they just don't offer the same kind of protection. So no, they just don't. I think one of the physicians might want to answer that as well.
Yeah, I would say, David, great question. We are now requiring a mask and shields on our clinical units, and mostly the shield is there to, I guess, for lack of a term, prevent a direct blast. So if someone coughs or sneezes right in your face, we know that not only can you get it through the mouth and nose, but the eyes also. So the face shield protects the eyes, but they work well in conjunction with each other. But the face shield is by no means a replacement for the mask. I completely agree.
So just to follow up on that, teachers, teachers shouldn't only wear a face shield while teaching a class. They should always be wearing a mask, facial covering, in your opinion.
That is correct.
Okay, that's all the questions I have. Thank you, guys. Have a good week.
Thank you, David. Now I want to go to Aaron Langston of Cmrl Channel 4. Aaron, how are you this morning? Good, good.
We have not, for BSA, Dr. Lamentier, we have not had any additional requests to take in patients from other parts of the state. Obviously, we take in patients often from other areas, small facilities in the Panhandle, adjacent and nearby rural hospitals, but nothing from further out regions of the state.
It's the same in Northwest, what Dr. Lamentier said. No, not from around the state, but we do continue to help the regional facilities.
So I don't have the exact number I have right now at other places. I know we've sent a total of 25, but some of those have already returned. I want to say the last number I heard was less than 5. While they have gone to multiple VA facilities, I think a majority have gone to San Antonio, but they have gone to other locations besides San Antonio. And then, like I said, we have about 4 more that are preparing to go in the next couple weeks if needed. And I'll be honest, even as these return, they are volunteering to go again if needed.
Thank you, Aaron. Now I want to go to Morgan Durden of KVI Channel 7. Morgan, how are you this morning?
Hi, good. How are you?
Good, good.
My question actually is about an ordinance that was discussed at City Council yesterday, but I believe it relates to COVID-19. It was Ordinance 7869, and it was this revision will authorize any peace officer to enforce certain health and safety regulations without going basically through a health officer. And I was just wondering why that ordinance was put into place.
Actually, that was not related to coronavirus. That is a ordinance that will enable police officers to issue citations or to issue warnings for bars and other establishments that serve food and fall under the environmental health codes if they have their doors open for vector control and things like that. So it is not a coronavirus related ordinance.
So it wasn't related to like seeing someone or a citizen wearing a mask and them not having to take it to the court first, they could just give a citation.
No, they're already authorized to do the interactions with the public regarding coronavirus and face coverings related to GA-29 already.
So they can give them a ticket or a citation right away?
Well, they have to do the warning first in accordance with the guidance from GA-29, but yes, they can.
Okay, thank you. That was my question.
All right, thank you, Morgan. Those are all the questions we had from our media. This concludes our news conference for today. Once again, we do these every Wednesday morning at 11 a.m. I want to thank our panel members who took the time out to participate today and provide this information to our community. We'll see everyone next week. This is David Henry, Communications Manager for the City of Amarillo. Thank you, everybody, for joining us. Thank you.
Thank you.
Thank you.